Welcome to the NopoGuard Mastery video. Let's learn some tips and tricks to get you immediately confident and comfortable with your NopoGuard. Here is the NopoGuard. It is designed to work with your own syringe, needles, and carpules of anesthetic. To start, notice the slide tabs on your NopoGuard. Make sure to orient these tabs in the ready position at the front of your NopoGuard. With the tabs in the ready position, slide the NopoGuard over your syringe before attaching the needle. If you orient the slots of the NopoGuard over the area where your carpule of anesthetic will be, it will allow for greater visibility during your injection. It's not critical, but some clinicians do find it helpful. At this point, you can add your needle just like you normally would. If you prefer to add your carpule before attaching your needle, that works as well. Tighten the needle to secure the NopoGuard onto the syringe. Now, you can remove the needle cap, but if you would like to practice a time or two with the cap still on, that's perfectly fine. Place your thumb and forefinger here on the back of the NopoGuard and then slide it forward as far as it will slide. It slides along this groove or track in the sheath right here. Once it stops, you can rotate the NopoGuard just a few millimeters or about 45 degrees. Notice there is no resistance as you rotate the NopoGuard. It will move freely in this window right here. It will rotate without any resistance, reminding you you're in the right spot. You can get a feel of that range of travel by lightly rotating the NopoGuard back and forth a few times. So again, when you slide the NopoGuard forward and it reaches the end of travel, you lightly rotate until it stops, then slide the NopoGuard back into the locked position. You can see there is another groove or track here. Just simply pull back until you hear and feel an audible and tactile click as the NopoGuard enters the secure position. You can practice that a couple times by just pushing it forward and then pulling it back. Think of the NopoGuard as moving along this track that forms the letter J. Okay, so here we are in a secure position. Add your carpule of anesthetic like you normally would, and you're ready for the injection process. Imagine now staying in the protected position all the way to the patient. And at this point, you can expose the needle to perform your injection. Simply slide the NopoGuard forward, rotate the NopoGuard that same few millimeters, or about 45 degrees, and then slide the NopoGuard back to expose the needle. Just like in the secure position, when you pull the NopoGuard back to unsheath the needle, you'll hear and feel that click, knowing confidently the NopoGuard is stable in that ready position. Proceed with your injection just like you normally would. Immediately after finishing the injection, slide the NopoGuard forward until it stops. Rotate it just that little bit, and then slide it back into the secure and safe position, sensing that click. Now your needle is protected immediately after the injection. Should you need to administer another carpule of anesthetic, you can exchange your carpule in this position just like you normally would by simply removing the old carpule and adding another one. NopoGuard also keeps you protected during the disposal of the needle after the appointment. First, remove the carpule. This isn't required, but it does make removal of the needle just a little bit easier. You'll notice these flexible finger tabs on the side of the NopoGuard. When you squeeze these flexible tabs, there is no risk of contacting the needle itself, only the hub of the needle, so you can apply a generous amount of pressure to securely contact the hub. Keeping the syringe held vertically and using your finger and thumb, press the flexible finger tabs to engage and grab the needle hub. Now, you are in control of the needle as you rotate your syringe off of the needle. Keeping constant pressure on the finger tabs and the hub of the needle, rotate the syringe, keeping the NopoGuard stationary until you can freely remove the syringe. Again, keep that same pressure on the flexible finger tabs throughout this step so the needle remains safely captured inside of the NopoGuard. Hold the NopoGuard directly over a vertically oriented sharps container and, keeping your fingers out of the way, lighten your finger pressure on the flexible tabs and needle hub, and the needle will drop out of the NopoGuard and fall safely into the sharps container while you keep a hold of the NopoGuard. Since the NopoGuard is reusable, we recommend getting it ready for the next use. Use your thumb and finger to simply pull the slide tabs back, rotate, and then slide the tabs all the way forward until you hear and feel that click again. Now, the NopoGuard is in the ready position so that you're ready to go when it comes out of your cassette or sterilization pouch. And that's it. You've kept yourself, your patient, and your team safe from needle stick injuries with the use of NopoGuard. Thanks for watching.